Welcome back, and if you're new here, welcome. My name is Terria. Today I want to talk about how does Medicaid pay for your adult day program services. Medicaid pays by a daily attendance rate and LOC, which is level of care that's required for the individuals that you support or provide a service for. Pretty much each individual has a level of care, which we refer to as a LOC. A level of care, we want to break down as far as what a level of care is and what staffing is required for that particular level of care. So, level one, the first level of care, is for somebody that requires intense medical needs, intense behavioral needs. So, level one is an individual that the team has identified that needs intense level of medical needs. Whether they have, their choke risk, their fall risk, they have seizures, something that falls in the realm of that requires, constant support, ongoing support, as well as somebody that has intense behavioral needs, like, they have intense self-injurious behaviors where they can harm themselves or harm another person. So they require a higher level of support. So for individuals that fall under that realm of level one, they require one-to-one staffing. So it's one staff to one individual. So you need to know this information so you know how to appropriately staff for the individual, and then you know what payment comes for that particular service. So typically level one individuals are paid at a higher rate because they require more supports. You're only going to have one staff with that particular individual supporting them throughout the day that they're, within your care, within your service. Of course, this particular staff requires a certain skill set, so they may be hired and paid at a higher rate than others. So when you're doing your budget, make sure you take that all into consideration because, yeah, they do pay. Level one pays at a higher pay rate, but the staff may make more. You're requiring one staff for that particular individual, so make sure financially it's beneficial for you. And then you can hire somebody at the rate that you need to, and it fits within your budget. Okay, so level two. Level two is an individual that requires moderate level of health needs and supports or behavioral needs, which means it's not an ongoing level of support. They may be redirected if they're having behavior. You're able to verbally redirect them, verbally ask them to take a walk with you. They're quickly redirected, or if it's medical needs, they may need, somewhat supports, maybe a little bit of supports in the bathroom, prompting that they need to wash their hands, just certain things like that. Maybe some supports with their food, use of microwaves. So, it's not, this particular individual is not requiring ongoing supports from a staffing person. So typically an individual that requires level two, LOC, level of care, it's one staff to two individuals. So you can utilize one of your staff and have them work with two individuals throughout the day. And for most, this is a better use of their funding, fits better with their budget. You can pay the staff at an average rate because they're not doing intense level of care. And then you can have them serve two individuals throughout the day that are in your building. Okay, lastly, level three. So level three is an individual that requires minimum to no health supports and behavioral supports. Typically, they're in your program to, either learn vocational skills, work skills. They're in your program to socialize, just have a better quality of life, but they don't require any medical supports. They don't require any behavioral supports. This particular level of care, you can have up to 5 individuals to one staff, which is amazing because you can definitely utilize that one staff, to support a realm of individuals. Same thing with this particular staff. You can pay them at the average pay rate because it's not an intense level of care that they're providing. It's more so just, helping the individuals, communicate. If the individuals have a goal, the staff is just helping them get to that goal through communicating, teaching them skill set. It's just more so active treatment throughout the day. So let me recap the level of care and the staffing that's required for the particular level of care. So like I said, level 1, individual requires intense level of care, and it's typically 1-to-1 staffing, 1 staff to 1 individual. Number 2, level of care, it's moderate supports required, and it's typically 1 staff to 2 individuals, 1 staff to 2 individuals. And then level 3, lastly, is minimum to none behavioral support and medical support. They pretty much are self-sufficient, independent, and it could be 5 individuals to 1 particular staff. So I hope this helps when you're thinking about how payment goes, how to staff for your agency. Each different level of care has a different pay. So you need to know what your particular individual's level of care. You need to know, your budget, how many individuals you're trying to get to ultimately. So if you're trying to, have an agency that has 50 individuals, do you want to fill that agency with a lot of 1-to-1s, or do you want to do 2-to-1s, 5-to-1s? So take this all into consideration when you're setting your goals, setting your plans for your agency, because you want to staff appropriately and you want to make sure you market for the appropriate individuals that fits with that, that fits with your ultimate goal, like a large agency, or do you want a smaller agency? Are you even interested in supporting individuals that require intense level of care, or do you want to, avoid the stress of that and, identifying the skill set of that and just support individuals that require minimum to no level of support? So you need to identify this in the beginning and be clear on what your vision is for your company. You need to be clear on, what the plan is and the ultimate goal is. So as always, if this resonated with you, please like and subscribe. If you know somebody that's interested in opening an adult day program, please share this. This information is definitely useful. So get it out. See you guys next time. Bye.